Today, the level of pollution in cities such as Delhi and Mumbai is equivalent to smoking 20 cigarettes per day. As if this were not enough, Indians' lifestyles have made matters worse. Indians are more vulnerable to heart disease due to their sedentary lifestyle and poor dietary habits, which include a high intake of saturated fat and calories. This, combined with tobacco use and stress, has resulted in Indians developing heart disease almost 10 years earlier than they did previously. The incidence of heart disease has increased dramatically over the past 3 decades, and 40 is the new 70 when it comes to heart disease. There are 3 patterns that are readily apparent. Overstretched clocks. Teenagers frequently take pride in watching an entire season of a television program in a single sitting. This may involve 10 to 12 hours of non-stop television viewing while consuming high-calorie snacks while slouched on couches. This dopamine-producing addiction is known to increase all-cause mortality and cardiovascular disease risk. Those who engage in this are writing their own premature obituaries. With no regard for the body's own circadian rhythm and a blatant disregard for the body's need for sleep to repair and prepare for the following day, perhaps the term freedom has been overused. Sleep deprivation causes stress and inflammation, which are red flags for the heart. Abstracted platefuls. Do you recall the variety of grains that were once consumed in Indian households? Jowar, bajra, ragi, water chestnut, maize, nakni, and vegetable flours. Each has unique biodiverse nutrients and glycemic indices, providing the body with a wide variety of nutrients. However, we now order food instead of preparing it, and the meals we consume are extremely unhealthy. They lack fiber, contain toxic substances, chemicals, and a high sodium content. In addition, these packaged foods, which are high in carbohydrates, cause your pancreas to work overtime, eventually resulting in diabetes. There are numerous diabetics in their 30s who have accepted a lifetime of comorbidities. Inattentive routines. When was the last time you walked 20 minutes to work as opposed to taking a taxi? Or did you spend a day cleaning your own home? Or decided to meditate rather than drink after a long day of work? Or have you smoked absent-mindedly to distract yourself or to feel a part of a group? Both air pollution and smoking weaken the lungs, which oxygenate the blood and harden the body's arteries, resulting in blockages. Significantly less oxygen is supplied to the rest of the body, and the heart must work harder to pump the same amount of oxygen. The increased metabolic demand on the heart can cause heart rhythm disturbances, cardiac muscle damage, and impair the heart's optimal blood pumping ability. The aforementioned patterns, when repeated over time, make stress, hypertension, and diabetes a daily occurrence, and force your heart to work harder. Worse yet, these problems will continue to amplify unless you take decisive action to change your habits. Your biological age could be 40, but your physiological age could be 70.